My name is Professor Karen Strickland, and I'm the chair of the Council of Deans of Nursing and Midwifery for Australia and New Zealand. So welcome to this event. It's a really historic event for us. I have to say it's really nice to see so many well-known faces from back home in lovely Scotland as well. I'm just going to, before we begin, in Australia, we acknowledge that we are joining you from the unceded lands of particular clans. So I'm joining you from Wajik Budja, which is in west of Australia. And I'd just like to pay my respects to the elders of the Noongar Nation, past, present and emerging. And I would also like to extend that respect to any Aboriginal Torres Strait Islander people who are on this call today. And also I'd like to extend that respect to any Maori colleagues who are joining from Aotearoa, New Zealand. And I'd just like to recognise that on International Nurses Day, that the Indigenous people were the first healers that walked the lands that I'm joining you from. So I'm delighted to be here to recognise this event, which is the signing of the Memorandum of Understanding, which follows on, just a bit of background, it follows on from a successful delegation to the UK by the Australian signatories back in March 2023, which was organised on behalf of Universities Australia Health Professions Education subgroup. And we held, when we were over in the UK, we held lots of meetings and discussions that highlighted that actually there were many shared areas of interest that we could benefit from cross-collaboration across the health professions, but also across our respective countries. So we made a commitment then that we would, once we came back to our own countries, we would follow on with ongoing dialogue with a view to setting up some formal collaborations. And that's culminated in today, where we celebrate the signing of this MOU. We know we've got increasingly close UK and Australian cooperation on a number of fronts, but also Aotearoa, New Zealand is an essential part of our Council of Deans for Nursing and Midwifery. So that extends this partnership. So I think it is clear that our organisations and members can learn a lot from each other and benefit from mutual support with this agreement will facilitate. I think what I'm seeing across Australia, Aotearoa and in the UK is that universities are being challenged even more than before, with government policies very similar in relation to international students, in relation to the support or lack thereof of the university sector in what are very tight economic times as well. Sorry? Okay. So this MOU will set out the terms and conditions, the terms and understanding between Council of Deans of Health UK, the Australian Council of Deans of Health Sciences, and the Council of Deans of Nursing, Midwifery Australia, Aotearoa and New Zealand for collaboration and support with each other in the fields of healthcare education and research. So I'd like to hand over to some of the panelists who are representatives of the collaboration. So first of all, we go to Ed Hughes, who's the Chief Executive of the Council of Deans of Health UK.
Morning, and thank you very much, Karen, for that introduction, and welcome and happy International Nurses Day to all of you health professionals on the call. I'm Ed Hughes. I'm the Chief Executive Officer at the Council of Deans of Health here in the UK, and it's a real pleasure to be able to be with you all this morning at the launch of the MOU that we're in the process of signing almost in real time, as far as that's possible in this virtual environment, with our colleagues in New Zealand and Australia. And it's it's taken a little while to get to this point, but I'm delighted to be able to bring people together to have this discussion this morning and to start to think about how we might take this work forward collaboratively amongst our members and see where the opportunities for future collaboration might be. Just very briefly, for those of you joining us from Australia and New Zealand who may not be so familiar with the background of the council here in the UK, Council of Deans of Health is an independent charity and membership organisation representing over 100 organisations delivering health education and research in the UK and indeed beyond in some of the Crown dependencies and overseas territories in the UK as well. We represent almost all of the higher education providers in the UK for nursing, midwifery and the allied health professions, and we work to advance the interests of and provide a voice for all of our members, trying to benefit healthcare students, patients and the wider health and social care system. And we've been working really hard over the last few years in what is a really demanding and complex higher education policy and funding landscape. As Karen alluded to, there are many challenges there for our universities in terms of financial sustainability and indeed for our students in terms of the cost of living and the affordability of health education from a student perspective. We also recognise that it's a very highly regulated landscape where we're regulated both by higher education regulation and also by health professional regulation. And whilst that is necessary and important, we're really committed to working with our members and with regulators to identify areas where there may be opportunities to streamline that regulation, to right-size that and make it more proportionate. We work both with pre-registration healthcare students and those who are qualified and seeking professional development and progression. And I think, one of the big areas that we've been working with and where we've had a number of conversations with colleagues in Australia and New Zealand over the last couple of years has been around advanced practice and how that fits into the wider professional training and the regulatory landscape. We've thought hard about the issues to do with simulation in practice learning and how technology and digital technologies are really driving that direction, and how students can respond to that, how universities need to invest in that, and how, again, that needs to fit within the funding and regulatory landscape. And we've thought hard in this space around also the research agenda, and it's an area where the UK has often looked to what's happening in Australia and New Zealand and vice versa in terms of research assessment and research funding and research prioritisation. And I think that's an area where, again, we might be able to have some really fruitful dialogue around how research and knowledge exchange is taken forward in our respective jurisdictions and how that works for the professional disciplines that we're working in. So I think there's lots for us to think about together as we move forward. I'm really pleased that we've got the opportunity to bring our members together to explore that further, and delighted that the Council of Deans of Health here in the UK is able to participate in this, and look forward to hearing ideas about how we can take that forward. So I'll hand back to you now, Karen.
Hey, thank you very much, Ed. I'd now like to invite Professor Terry Haynes, who's the chair of the Australian Council of Deans of Health Sciences.
Thank you very much, Karen. I'd too like to extend my warmest regards to all the nurses out there on International Nurses Day. My wife is a nurse, my daughter is a nurse, and I am often surrounded by nurses in my daily and professional life, and am enriched for being so. The Australian Council of Deans of Health Sciences is the peak representative organisation for Australian universities that provide education for clinical allied health professionals. We have 32 member organisations in Australia presently, and we are drawn from a history of being a collective of allied health educating universities that has been a bit of a motley crew for a number of years, that has gradually grown. And in 2022, we became a company limited by guarantee and a registered charity. So we've recently formalised those arrangements. And Sean McDonough, who's on screen as well for some of you, is our intrepid company executive director. There are a number of pieces of work that we focus on as a collective. We've recently had a face-to-face meeting in Canberra in Australia, and we've re-examined those priorities and added to them and taken away a little bit. And we're in a constant process of evolving our activities. The things that we have a lot of focus on at the moment are developing our rural and regional allied health workforce to improve accessibility to care for people in our community, looking at how we go about harmonisation and streamlining of accreditation procedures across the different allied health disciplines in particular. We're in the process of having a national allied health workforce strategy about to be released, and we'll be very interested in how that is rolled out and want to contribute to that. We are interested in developing the emerging academic leaders in the allied health professions, and we're also very interested in the clinical education models, being able to share models that build capacity for education, but also in the space of university-run clinical education models, and viewing them not just as a tool of education, but as actually a part of what could be a part of the core part of what a health system is, in being able to reach people who cannot access services otherwise, at the same time as delivering educational benefits for our students. So there are a number of the areas that we've recently prioritised for work. We currently divide ourselves at the board level. We've got 6 board members at the moment, with another 2 about to be appointed by the board. And each board member takes carriage for one of those areas of work, and a number of the members contribute to a working group focused on those particular topic areas as a way to drive our activities forward. So the memorandum of understanding that we have entered into, I should acknowledge Professor Michelle Lincoln, who's been very much involved in establishing this memorandum of understanding, that this is something which is a great opportunity for us to be able to learn, to be able to share our experiences, and to be able to make advances for our members and for the society that we serve through our roles. I might leave it at that for tonight.
Okay, thank you, Terry. And it's good that we had an Aussie accent online as well, as everyone would expect at least one. So now I'm going to hand over to Professor Julia Slark, who's the Board Director of the Council of Deans of Nursing and Midwifery for Australia, Aotearoa, New Zealand, but also is the chair of the Aotearoa New Zealand group of deans. So over to you, Julia.
Kia ora, Karen. Kia ora koutou, ko Julia Slark toku ingoa, te urumatua o te kuratapui o te Waipapa Taumataro. Tēnā koutou, tēnā tātou katoa. Hi everyone, my name is Julia Slark, as Karen said, and I'm head of the School of Nursing at the University of Auckland in Auckland, New Zealand, but also chair of the Council of Deans Aotearoa. Council of Deans in New Zealand consists of 7 universities delivering pre-reg nursing education. The University of Auckland, Massey University, Auckland University of Technology, Waikato University, Victoria University of Wellington, the University of Canterbury, and Otago University in the Deep South. 2 of the universities also deliver pre-registration midwifery education. And there are growing numbers of midwifery in New Zealand. We're currently graduating about 200 midwives a year and 2,500 registered nurses each year. We're delivering the education in the university sector with smaller percentage of the overall number of registered nurses that are qualifying, with about 75% coming out of the polytech sector. But, you know, we, as a university sector, we take the education really seriously. We're also really research intensive universities with established research programs supporting nurses and midwives to undertake research masters and PhD and doctoral studies. We're really excited to be a part of this initiative and this MOU. And this is a really good opportunity, International Nurses Day, to come together and explore those opportunities of how we can learn from each other, but also find new ways of working together in the future. So thanks very much for having me come on this evening. It's 8 o'clock here, so it's nearly bedtime, but it's great to be a part of this. And so, yeah, ka kite, kia ora, thank you.
Thank you, Julia. So now what's going